Today I will be talking about how to clean a site for a button type of G-tube or J-tube. This type of tube is placed in surgery. The site is the skin around where the tube is placed. I will tell you how to care for the tube and site. First, I would like to go over what to expect when the tube is placed. The site will be tender for up to 2 weeks. The first couple days after the tube is put in are when it is most tender. Expect drainage at the site, especially some bloody drainage for the first few days after the tube is put in. This is normal while the tract is healing. The tract is the hole where the tube is placed. Gauze at the site is best when there is drainage to help soak it up. This will stop the drainage from drying up on the skin, which may irritate the skin. 1 split gauze is all that should be needed if there is drainage. Once the drainage stops, then it is best to leave the site open to air. Site cares should be done every day. You want to start this the day after surgery. After 1 week, it is okay for your child to take a bath. However, no swimming for 1 month. Your doctor or nurse will let you know when to give your child's feedings and how much to give. Please watch our Feeding Through a G-tube video on how to do this. Now I will show you how to take care of a button type of tube. It looks like this. It has a balloon filled with water, which will be on the inside against the stomach to stop the tube from falling out. Your child will have this tube for at least 6 weeks unless your child's doctor tells you different. To do site cares, you will need soap and water, washcloth or Q-tips, tape, and split gauze if needed. Before you start cares, wash your hands with soap and water. The site should be cleaned every day with soap and water. You can use Q-tips, a washcloth, or gauze to clean the site. First, clean with soapy water, then rinse the site with water, and dry the site very well. If a site is left wet, this can create moisture, which can lead to problems. You can clean the site just as I showed you, or you can clean the site while your child is in the bathtub or shower. It is also important to spin the tube in the tract each day with site cares. This stops the skin from sticking to the tube. Begin this the day after surgery unless there are stitches. Then wait to spin the tube until after the stitches are gone. If your child has drainage, 1 piece of split gauze should be used at the site to help absorb drainage. This also stops the drainage from irritating the skin. Change the gauze every day with cares or more often if needed. If there is no drainage, then it is best to leave the site open to air. The other important thing to help keep the tract healthy is to stabilize or secure the tube. With the button type of tube, you will need an extension set to give medicine and feedings. This extension set should stay attached for the first 3 days after the tube is put in. This is because the site is very tender for the first couple days, so it is best to try not to connect and disconnect the extension set a lot during this time. The extension set should be secured with a tension loop during the first 3 days. The tension loop helps stop the tube from wiggling and allow the tract to heal. To place a tension loop, take a piece of tape and fold it around the tube until the tape meets. Pinch the tape together where it meets. Put the ends of the tape onto the skin. After 3 days, when the tenderness is better, then the extension set should be removed anytime the tube is not being used. This will keep the tube even more secure. Only keep the extension set connected when giving medicine and feedings. If your child needs to have the extension set attached for continuous feedings, be sure to secure with a tension loop. Other ways to stabilize the tube are to protect the site from being pulled on or bumped. Some simple ways are putting a 1-piece clothing on your child that has snaps, such as a onesie, putting an elastic wrap around the tummy and back, such as a ace wrap, belly binder, or a large hairband, and make sure you tuck in their clothing. Your child's tract will be healed after their tube has been in place for 6 weeks. The tube will be changed to a button type of tube. This is called a primary tube change. This usually takes place in surgery clinic, and they will let you know the date, time, and what to do before you come to this appointment. After the tube is changed for the first time, the nurses will teach you how to change it. Your child may need to have an X-ray type of test after the tube is changed to make sure the tube is in the right spot. This is where a little bit of dye is placed in your child's tube, and an x-ray will be able to see if the tube is in the stomach. After the first tube change, you will get a spare button type of tube sent to your home. The most important key things to remember helping the site heal are a clean site, a dry site, and a stable site. If there are any problems with the tube or the site that you are not able to take care of, call your child's doctor or nurse. The most common problems that can be taken care of at home are redness that is not spreading. Other common problems that happen when you may need to call are redness that does not go away or that starts to spread, leaking or increased drainage, granulation tissue, if the tube is too tight or too loose, if the G-tube falls out before your child has had their very first tube change, the primary G-tube change, do not put anything in the tract. Cover the G-tube hole and call your child's doctor or nurse right away. If the tube falls out on the weekend or off hours, take your child to the emergency room. Thank you for watching.